Welcome back to Heart Attack Awareness. If you care about your heart or someone else's, please subscribe and hit that bell right now. Every week, we share urgent, science-backed strategies to protect your heart, recognize danger early, and respond effectively. Because when a heart attack happens, minutes matter. Today's video will teach you what to do in the first 5 minutes of a heart attack. That's 300 seconds that can mean the difference between life and death, between full recovery and lifelong disability. We're not talking theory, we're talking real-world, step-by-step actions that can save a life. Minute 0 to 1. Recognize the warning signs and call emergency services. The very first step is recognizing that a heart attack is happening. Classic symptoms include chest discomfort, shortness of breath, pain radiating to jaw/arms/back. But people often experience nausea, cold sweats, dizziness, or unusual fatigue first. Women may experience more subtle signs like indigestion or jaw pain. Whatever form it takes, if you suspect it, don't wait. Grab your phone and call emergency services. In the US, 911. Explain clearly, "I think I am having a heart attack." Mention your symptoms succinctly. This not only sets EMS in motion but primes dispatch for immediate response. Every second counts. Minute 1 to 2. Sit, loosen, and chew aspirin, if safe to do so. As you wait for help, sit upright in a chair. Avoid lying flat. Sitting reduces pressure on your heart and lungs. Loosen tight clothing, no belts or ties. If you have aspirin nearby and are not allergic, chew a single full-dose adult aspirin, 325 milligrams, or 4 low-dose baby aspirins, 81 milligrams each. Chewing allows faster absorption and helps reduce clot formation. This could significantly limit heart damage when combined with quick treatment. If you're already on blood thinners or aren't sure about aspirin, still call EMS first, then follow existing medical guidance. Minute 2 to 3. Use sublingual nitroglycerin, if prescribed. If you already have sublingual nitroglycerin under the tongue, prescribed for angina, use it exactly as directed, typically 1 pill. This helps dilate blood vessels, improving blood flow to the heart and reducing pain. Relief might be partial, but it buys precious time. If the pain persists or returns after 5 minutes, you can take a second dose, but never take more than 3 doses total without immediate medical supervision. Timing and dosage are critical, so follow your doctor's advice. Minute 3 to 4. Relax. Controlled breathing reduces stress. At this point, your heart is under extreme stress. Staying calm helps keep your heart rate and blood pressure lower. Practice deep, controlled breathing. Inhale slowly for 4 counts, hold for 2, exhale for 6. Replace panic with purpose. Control frees your nervous system from overreacting. This simple step can reduce adrenaline surges, which otherwise make heart damage worse. Minute 4 to 5. Prepare for EMS arrival. Now that you're working to stabilize yourself, it's time to prepare for when help arrives. Sit near the door so EMS can enter quickly. Unlock the door or tell someone to ensure access. Have emergency info ready: your name, age, health conditions, current medications, allergies. Keep phones charged and accessible. If living with others, instruct them to stay near you, share this video's instructions, and monitor your breathing and pulse. Beyond minute 5, second phase, diagnosis and hospital preparation. After EMS arrives, your role shifts. Be honest. Describe your symptoms fully, even if they changed. Provide medical history, medications, and the time symptoms began. Ask for an ECG to be done en route. EMS may give oxygen, morphine, nitro drip, or start aspirin again. Be alert, stay calm, and let them do their job. In the ER, you'll receive a blood test, troponin, ECG, and potentially imaging. Based on results, you may undergo angioplasty, stenting, clot-busting medication, or other interventions. Recovery protocols, including cardiac rehabilitation, begin soon, so compliance is essential. Why these steps matter: science and evidence. Early EMS activation reduces time to treatment, saving muscle and improving survival. Aspirin given within the first minute reduces heart damage by preventing clot growth. Nitroglycerin relieves vascular strain and improves blood flow. Controlled breathing helps minimize stress hormones that worsen ischemia. These steps, when combined with quick medical care, significantly improve outcomes. Research shows in-hospital mortality decreases by up to 50% when patients receive early EMS, aspirin, nitro, and stress reduction. Special considerations. If alone, call EMS immediately. Don't wait for symptoms to get worse. If choking or unconscious, trained bystander may perform CPR. If you're alone, chew aspirin even if unconscious, as long as you don't have allergies. If you're unable to swallow aspirin or take nitro, stick with breathing exercises and unlock the door, so EMS can bypass entry delays. Real-life example. Meet Samuel, 54, who experienced jaw discomfort and mild nausea. He self-administered aspirin, sat upright, and practiced deep breathing. When EMS came, his ECG had stabilized slightly, and vital minutes were gained. At the hospital, he received stenting and fully recovered, returning to his grandchildren in under a month. Preventive phase post-emergency. Short-term survival isn't the goal, it's long-term health. Use this incident as a turning point. Attend cardiac rehab to improve heart strength. Follow medications: ACE inhibitors, statins, aspirin. Adopt a heart-healthy lifestyle: plant-based diet, moderate exercise, stress reduction. Monitor blood pressure, cholesterol, glucose regularly. Enlist emotional support. A heart event can cause PTSD or anxiety. Therapy helps. Closing thoughts. The first 5 minutes of a heart attack are crucial. There's no time for second guessing. Recognize the warning. Call EMS. Sit, loosen up, chew aspirin. Use nitroglycerin if available. Breathe intentionally. Prepare for your rescuers. These steps can reduce heart damage, improve survival, and preserve quality of life. Thank you for watching Heart Attack Awareness. If this video empowers you or someone you care about, please like, share, and subscribe. You may help save someone's life. Next time, we'll teach you top strategies to lower your heart attack risk naturally. Stay safe, stay prepared.